It's bigger. Okay. Okay. So I thought that today, since we're in the middle of a pandemic, we would talk about COVID-19 because I think there are probably more questions about it than there are actual answers. But I thought we go over the neurologic complications of COVID-19 because I think that is a big question in everybody's mind, especially now the vaccines are rolling out and who gets on the list as the first group of people to be able to get the vaccine, and why is it that certain people are placed ahead of other people in terms of the timeline for getting vaccinated, who's more at risk, and what actually are the problems that result, or at least neurologic problems that result of the COVID-19 infection. So I think I get questions from patients, I get questions from my friends as if I'm a doctor and I should know everything. So I thought I would put this into a neat package and hopefully enlighten all of us about what can go wrong as a consequence of COVID-19. So just to start out, the pandemic that we're in started as an outbreak in China in December of 2019. And essentially it's a respiratory syndrome. It's a severe acute respiratory syndrome, shortness of breath, difficulty breathing, sometimes necessitating ventilatory support. It quickly spread to involve the entire world pretty much. So multiple countries being affected, rapid progression of spread, which is then what classified it as a pandemic. The most common symptoms are respiratory. So it is a pneumonia. It causes acute respiratory distress syndrome. People lose their ability to oxygenate their blood, so they're short of breath, or they don't feel short of breath, but their actual blood oxygen levels are very, very low, which is not compatible with thinking clearly and functioning well. People can be affected mildly, or they can be affected more severely. So the mild symptoms are fever, fatigue, and cough. The more severe symptoms, obviously respiratory distress, and then it can cause kidney failure, heart failure, and obviously death. These are statistics that I pulled in the last week, just looking at the overall numbers in the United States. So far, we've had 490,000 deaths and 27.9 million cases. Worldwide, it's is that right? Yes. 2.4 million deaths and 110 million cases. So this is a huge worldwide problem that we're all dealing with, and it's nothing that any of us have lived through before. I think there are probably very few, if any, people that survived the last pandemic we had, which was the Spanish flu in like 1914. So I doubt that anybody is alive that survived that. There may be people that had family members that did survive that, so they have a sense of what the sequela of that kind of a pandemic was, or what it was like to live through a pandemic like that. But in our collective human experience, there hasn't been anything like this that we have any point of reference for. So that's what makes it even worse for all of us trying to deal with it. the neurologic issues in terms of COVID-19 is primarily respiratory. So the fear has been respiratory failure, the need for ventilatory support, and that's where our hospital system has gotten overwhelmed, not having the appropriate um, machines or the number of machines needed to take care of all the people that needed them, especially when the numbers started rising so acutely and so fast. But there's two different ways that the virus can get into the central nervous system. One is through the nose. There's a very small sort of bony plate at the top of your nose, between your nose and your brain, and the virus, if it's inhaled, can go through that cribriform plate and gain access to the brain. Or it can get into your bloodstream and then get into the central nervous system that way. We still don't know. When I looked at the literature in terms of trying to get ready for this talk, it's not clear if the neurologic problems are really the result of the virus getting directly into the brain or the central nervous system, or they're the result of the other organs that are damaged, and then the toxins from those other organs not working, building up and causing neurologic issues. So definitely people that are sicker are much more likely to have neurologic issues from the virus. And we worry about all the complications of the virus from the multi-organ failure as well as the primary neurologic issues. So what kind of neurologic issues are we talking about? The first one I want to just touch on is the anosmia, the lack of the sense of smell, which is very, very common as one of the initial things that people notice when they are infected with COVID-19. And so I'll admit that in my house every morning we wake up and check if we can smell things. And I guess lucky or not, I don't know if I should share this here, but I have an old dog who doesn't always make it to the backyard when he has to poop. So that has been my way of checking that I did not have COVID, is as long as I can smell when he's had an accident, I think everything is good. So that's my way of turning negatives into positives, which is important for all of us to do in the midst of a pandemic. But that lack of sense of smell is very common, happens to the majority of people early in the course of the disease. So I think it's a pretty good indicator that somehow the virus is getting into your central nervous system and at least affecting your olfactory system so that it impairs your sense of smell and then impairs your sense of taste. And headache is also one of the early symptoms of COVID-19. So lots of people complain of headaches, diffuse body aches, dizziness. Confusion can happen sort of at any course along the timeline of the infection. It can happen in the beginning. It can happen after you've recovered from the infection. There's a lot of literature about brain fog related to COVID-19, so that people, even though they have recovered from the respiratory part of the illness and the other issues in the illness, still are feeling like their thinking is not clear and they're just not as sharp as they were, and that can persist for variable periods of time. So we are ending up seeing a lot of people with sort of, after recovery from the illness, a lot of complaints, more non-specific complaints of fogginess, tiredness, lack of motivation, mood issues that it's hard to piece together exactly what part of the nervous system was damaged to cause these symptoms, or how they are related to the infection itself, as opposed to just the whole situation of being infected and living in a pandemic. Stroke was the first major neurologic complication that was noticed in terms of hospitalized patients with COVID-19, and seizures are much less common, but we're going to go into all of those in a little bit more detail as we go on. But definitely there's a variety of ways that this virus affects the central nervous system, and a lot of issues that people who are infected have to deal with neurologically. And especially, I think you want to keep this in mind in terms of Huntington's as well, which is already potentially causing problems with thinking, problems with mood, problems with levels of consciousness, problems with balance, problems with energy and motivation. So all of those things, it's hard to tease out what's the virus and what's the disease. So it is going to be challenging for all of us, I think, as time goes on. The other thing to keep in mind, and this is not specific to COVID-19, is that when you have a neurologic illness or you have any kind of illness, but something like Huntington's disease, your body is doing everything it can to compensate for the problems associated with HD. So it is working overtime, trying to keep your balance good, trying to keep your speech good, trying to keep your swallowing good. And all of those things are going on without your consciously knowing that that's what's happening. But then if you get sick with something else, if there's some other stressor on your body, whether it's a physical stressor, like you fell and broke your hip, whether it's a infectious stressor, like a virus, like COVID-19, or it's an emotional stressor, like you lost your job, or your kids went off to college and moved away. Any of those additional stressors are gonna sort of end up at the front of the line in terms of what your body needs to process and what your body needs to take care of. So the Huntington's is going to take a back burner while these new stressors are being addressed by your body, which means that your Huntington's symptoms may worsen. If you have extra movements, they may get worse. If you're not thinking clearly, that may get worse. If you have a tendency to be depressed or have more obsessive compulsive thoughts, those things may increase when you're trying to deal with the new stressor. So that is typical no matter what the stressor is. But in a pandemic where that stressor, it doesn't just go away quickly. Like if you break your hip, you have surgery or you go to rehab and things get better in a period of weeks or maybe a couple of months. This has gone on for a year and we don't have any sense of when it's going to be over. So that is going to wreak havoc with the other conditions that people have and that have been trying to compensate for. So that is all normal in terms of having a chronic disease and having additional stressors on it. I think that what is unique about this is that it is a pandemic and that we don't have enough information about when it will be over or when things will start to get better. So there is so much uncertainty around this that is going to make things much worse for all of us, with or without Huntington's disease. Okay, so let's talk about stroke for a second, because this is the first issue that was really brought to the attention of doctors who were treating patients in the hospital. And what they were seeing was big strokes in people, even young people, who had been infected with COVID. What happens is that the virus gets into the lungs and it causes damage to the very small parts of the lungs. That is where the blood exchanges the oxygenated blood for the blood that's already had the oxygen taken out of it. And this damage triggers an inflammatory response. So when things get damaged, inflammatory cells come in, they release chemicals that promote the inflammation, that bring white blood cells in to help and cause swelling and things like that. So those inflammatory chemicals are released, and those inflammatory chemicals can actually damage blood vessels. So in a normal blood vessel, the inside of the blood vessel is nice and smooth so that nothing sticks to it. But when those inflammatory chemicals get in there, they start to damage it and it's not so smooth. And it makes the smoothness is what makes things not stick to it, because you want your blood vessels to be smooth so the blood can easily flow through. If there's damage and it's not smooth, then things start to stick to it and the blood vessel gets narrowed, and then more things stick to it and it gets more narrowed, and eventually the blood can't get past that narrowed area and causes damage to whatever that blood vessel was supplying. Also, the things that stick to it can break off and fly up to other parts of the body where they don't belong. So that's what we worry about, what we call thrombosis, where these little sort of blood clots clog up the blood vessels, and then they can break apart from smaller blood vessels and go to larger blood vessels and go up to the brain and cause blockage in the blood vessels there, and that causes a stroke. So that is how sort of the mechanism of how COVID causes strokes in people that otherwise would not be at risk for stroke. We also know that not moving around predisposes us to blood clots. Those are blood clots in the veins, not so much in the arteries. But deep vein thrombosis is a complication of being in one position for a long period of time, or not getting up and walking as much as you used to. So we definitely see that in hospitalized patients, getting deep vein thrombosis, which can then break out off of the leg veins and travel up to the lungs and cause what's called a pulmonary embolism. If the heart is not completely intact, sometimes those clots can go through the heart and up to the brain as well. So that is another cause of, or potential cause of, stroke that we see in hospitalized patients with or without COVID. And that's why if you're ever in the hospital, the reason that they put those compression boots on you, those boots that sort of blow up and squeeze the bottom of your leg sort of rhythmically, is to prevent those blood clots if you can't get up and walk. So ideally, the best thing to do to prevent those blood clots forming in your legs is to move. But if for whatever reason that you're in the hospital, you're not allowed out of bed, you can't really get up and move, then they use those compression stockings, and sometimes they'll actually use blood thinners that they give you every day to try and make it so that nothing sticks to the inside of your blood vessels and causes clots that can give you problems down the road. So stroke is a major complication that was sort of an unexpected complication of what we thought initially was a respiratory disease, but ended up being a big problem for people who were hospitalized with COVID down the road. And then the sequela of stroke is that after you've had a stroke, depending on what part of your brain was damaged in the stroke, you're left with the damage from that, whether it caused vision problems, whether it caused weakness or sensory loss or incoordination. Having COVID doesn't predispose one part of your brain to getting damaged. So then you need not only to have rehab to help with your lung function and your breathing and your energy, but also to get better in terms of the damage that the stroke would have caused, whether it's language or strength or sensation or walking. So those are things that people are dealing with after they get out of the hospital as well. There is another condition called critical illness polyneuropathy or myopathy. So this happens in people who have been in the intensive care unit for a long time. And they're essentially, again, it's due to this diffuse inflammation that happens, and the chemicals damage the blood vessels that go to the nerves and the muscles, and then the nerves and the muscles don't work. So patients with critical illness polyneuropathy or critical illness myopathy are weak. They really can be so severely weak that they can't move at all. And because especially our peripheral nerves don't have a very good blood supply, when they get damaged, it takes a very, very, very long time. I'm talking months and months and months to get better. So this can be a very hard thing to treat. And ideally getting the patient better from whatever their underlying illness is and getting them out of the intensive care unit as quickly as possible should help to get them better faster. But it is a very, very slow process, and that can keep them in the hospital longer than they would have been otherwise if they didn't contract this. So it's something that we as neurologists, when we are going in to see people in the hospital, when we get consulted because they're weak, this is something that's always in the back of our minds as something that could be a problem in patients who are in the hospital for a long time and who are very sick. Seizures is another thing that we worry about. People who have been in the hospital or in the intensive care unit. In people who already have seizures or people who have epilepsy, there's definitely been seen to be an increase in seizure frequency in patients with COVID-19. And there's a lot of reasons that this could be. One could be that you can't get to your doctor because it's a pandemic and you can't actually physically get to see them, or you're nervous that going to the doctor's office is going to lead to exposure to people that could be sick, so you don't go. It could have to do with not being able to get your medicine. Some people don't get to the pharmacy. The pharmacies may not stock everything that they used to have. The mail service, as you know, in the past year has been abysmal. So people that get mail order medicines their medicine may have been delayed. And seizure medicines for sure are things that you need to take every day. You need to have a steady level of that medicine in your bloodstream so that it can keep you from having seizures. And if you miss it for a week or a number of days, then that level is going to go down and it's going to predispose you to more seizures. And again, the stress, just as we talked about before, the stress, any additional stressor is going to make it harder for you to cope with the disease that you already had. So the additional stress can affect sleep, which sleep deprivation definitely leads to more seizures. And so that stress as a sort of a big all-encompassing term can make people who have had seizures have more seizures. In people who have never had seizures before, we do see an increased incidence in seizures with the virus that can be from not getting enough oxygen. So definitely from the pulmonary issues where you're not getting enough oxygen in your bloodstream, that deprives your brain of oxygen and then can cause seizures. Other metabolic problems, like if your liver isn't working or your kidney isn't working or your ammonia level is building up, all those things can predispose to seizures. Other kinds of organ failure can cause seizures. So the kidney, liver, heart failure, all of those pulmonary failure, all of those things lead to buildup of products that can make you more susceptible to seizures. Definitely medications. So typically when you're in the hospital, medications are added that you hadn't been on before. Some antibiotics make it more likely for you to have seizures. Some other medicines that could interact with medicines that you're typically taking can make you have seizures. So it's really important to look at what medicines you're taking, if the medicines that they've added in the hospital make it more likely for you to have a seizure. And then brain damage. Definitely having a stroke, having a part of your brain that is damaged, that part then becomes a little bit more irritable. Cells are firing when they shouldn't, and that can cause a seizure as well. So we do see in hospitalized patients with COVID-19 an increase in seizures more than would have been expected. Encephalopathy is a fancy word for saying that your brain isn't working quite right, usually characterized by symptoms of confusion, sometimes hallucinations and psychosis as well. We see it frequently in people who are in the intensive care unit. Um, and some of that is just from being in the intensive care unit. If you've ever spent any time in the hospital in an intensive care unit, the lights are on all the time. So your whole day night sense is gone. It's light, it's noisy, it's not easy to sleep in there. There's people, because you're so sick, there are people in there checking on you every hour or so to check your blood pressure, to make sure your IV is okay, so that it's hard to get a decent night's sleep. It's hard to know what time of day it is. There are not things that tell you what day of the week it is, what month it is, so your sense of time is distorted and gone. So it is very easy to get confused when you're in the intensive care unit. Other things, just like we talked about with the seizures, that can make you confused when you're in the hospital are lack of oxygen, if your kidneys aren't working, if your liver's not working, if you have a bad infection, that can make you confused, if you have a fever. And again, certain medications, as well as problems with sleeping, not having familiar faces around, not having people that you know, and especially during this pandemic when visitors are restricted to the hospital. So you end up in the hospital with COVID and nobody that you know can see you. You're sort of at the mercy of all these strangers who come in, and they're all masked up and gowned up, so you can't even really see their face. It's very confusing, and it's a very sort of novel problem that we hadn't had before, because at least sort of the human characteristics of the people that are caring for you when you're in the hospital were obvious before, but now these are masked people with eye covering and gowns on, and so it's even hard to recognize the same person who comes in from one day to the next, especially if the equipment is noisy and it's hard to hear their voice through their mask. It is a setup for a lot of confusion in patients who are hospitalized during a pandemic. Okay, now let's talk about the sort of the neuropsychiatric complications of COVID-19, which I think is huge in the Huntington's population. The confusion is very common. Sort of being less oriented, not knowing exactly where you are, what day it is, what time of day it is, that kind of confusion. They've also seen a lot of what they call a dysexecutive syndrome, which can also be a problem just in Huntington's without COVID. But it could be made worse by the disease. So not being able to pay attention, not knowing exactly where you are, not being able to plan things out. There is definitely a rise in post-traumatic stress disorder. I mean, I think that we've been living with this pandemic for so long that we sort of forget that this is a pandemic. This is a huge, huge stressor to be living in an era where people are dying, people who are not sick are dying, young people, children, older people, family members. You can't spend time with them. You can't see them when you want to. Even just living your normal life, you can't see your family members because we're too afraid of infection. All the holidays last year were spent much more in isolation than they had ever been before. So that's traumatic for many people. And so it's not, it's not the same kind of trauma as having been in war, but it is traumatic nonetheless. And so people have nightmares, people have flashbacks to being in the hospital, being isolated, or flashbacks of imagining their family members all alone in the hospital and not being able to see them. So we need to really be cognizant of the fact that this whole pandemic has been a trauma for all of us, and that PTSD is not a diagnosis to be ashamed of, or is not something that only happens in people who've been abused or people who've been at war, but people who've lived through pandemics can get it as well. Definitely worsening mood symptoms, worsening depression and anxiety, suicidal ideation, and mood swings are all seen as complications of the pandemic. We see people getting more psychotic, having hallucinations, having delusions, believing things that are not true, and then those non-specific symptoms of just feeling tired, feeling irritable, feeling like they just don't care about anything, they have no motivation to do things. All of these seem to be sort of side effects of this pandemic, for people with neurologic issues and for people without neurologic issues. So it's very, very pervasive. It's very, very common, and just one more thing that we get to blame on COVID-19. Eating habits. This I thought was interesting. There was a study done in Italy, um, looking at over 3,000 people. They studied them from kids to older people, and 48% of them felt that they had gained weight from the pandemic. So what happens when you have a pandemic and you have sort of forced isolation is that we all stay home. And what do we do when we stay home? Well, we may not be able to go to the grocery store to get as many fresh fruits and vegetables and healthy stuff for us to eat. So we eat the stuff that is in our cabinets, which is pasta and rice and all the comfort food that we love, but it's not so healthy. So we gain weight. We're also told that we need to stay away from other people, and we can't go to the gym anymore because the gyms are closed. So it's a lot of sedentary activity. We're not going out, we're not exercising, we're not doing as much physical activity, and we're eating to try and make ourselves feel better because we're bored, because we can't see our family, because we feel bad, and lots of people will use food as comfort, and so they will eat more. Interestingly, a small percentage of people quit smoking during COVID, which may again be access to cigarettes, not being able to go to the store as often, not being able to get out and get the stuff that you're used to getting. Only about a third, a little more than a third, people actually increased their physical activity, so that when they were not able to go to the gym anymore, they found other ways to increase their activity, maybe walking around outside if they had a place that didn't have a lot of people in it. And then another small percentage of people started eating healthier, so eating more organic food, trying to beef up on the fresher food and trying to keep themselves healthy that way, because that was something proactive that they could do to try and increase their health. So there's a lot of changes in eating habits seen during COVID. And so trying to be attentive to what people are eating and looking at eating behaviors to try to keep us eating as normally and as healthily as possible is really important, especially in the wake of a pandemic. There is also something that we see called defeat stress. So where we feel unable to cope with what's going on in front of us and to make things better. which is huge in the setting of a pandemic like this, where here's this virus, so many people are getting it, and what can we do to make things better? It seems like a very daunting question, that there may be nothing that we can do, or we may feel like there's nothing that we could do, and why should we try, because there's no hope. It is not, it can lead to demoralization, um, which is not responsive to medication. If you really feel like there's absolutely nothing you can do and there's no hope, antidepressants are not going to help you. So, what we need to find, or what we need to do when people are feeling this kind of defeat stress, is to be encouraging, to be supportive, to try and get them engaged in things that they can master, so that you feel like you have some control back. So let's say, so we're in the middle of a pandemic. I'm feeling terrible. I'm feeling like there's absolutely nothing to do. You know what? Maybe I could learn to make bread. And so which probably other people had this idea because there was no yeast for a really long time. But so you get the ingredients, you practice making bread, and eventually you make a good loaf of bread, and you feel like, look, I can do something. I can learn something. I can do something positive. I can master some skill, even though I can't get control over the pandemic. I can get control of this one little thing. And that helps to get rid of that defeat stress and avoid that sense of demoralization, where it just takes away your feeling that you have any power over anything. So this also is something for all of us to keep an eye on in the middle of a pandemic, is really trying to find stuff that we can do that makes us feel competent, in the face of something that is making us feel really powerless. Depression. We all worry about depression, especially in Huntington's disease, but definitely in the United States, they've seen higher levels of depression during COVID-19, 3 times higher in all age groups than before. Women definitely more so than men. So if you're going to say that 10% of women were depressed before COVID, during COVID, about a third of women report being depressed. Men, 6.9% before, and during 22%. Married people do have lower depression rates than people who are not married, who are widowed or divorced or separated. People who have lower incomes are more likely to be depressed than people who have higher incomes, and especially in the light of the sort of employment status, that so many people got laid off because of COVID, that not having enough money becomes a huge concern. If you didn't have a stockpiled amount of savings and you're really living from paycheck to paycheck, or stimulus check to stimulus check, that is very unnerving and very depressing. So it makes sense that people who had higher income jobs, who were able to maintain their job, had less depression than people who have lower income jobs and who don't have a lot of savings. The other stressors in your life also contribute to depression. So having other stressors besides just the COVID makes it much more likely that you're going to be depressed. So definitely talking about mood, asking about mood, to family members, making sure that this is not sort of left on the back burner so that things get out of control. There are definitely medicines, therapies, online therapy has been much more available since COVID started, so that there are still people to talk to, even if you can't physically get to them. But this is not something to be ignored, because we don't want to see rises in suicidal ideation or suicidal behavior because of the pandemic. And in patients that could be treated despite the pandemic. And this is just looking at statistics during COVID. You can see the lighter blue color is during COVID, and the darker green color is before COVID, years before COVID. And you can see that the numbers of people with mild, moderate, moderately severe, and severe depression has increased significantly during this pandemic. So it's a huge problem, and it's something that we're gonna need to address, but it is not something to be embarrassed about, and it should be something that you talk to family members about, and talk to healthcare providers about as well, so that it can be treated, because it is treatable. Sleep is another thing. Okay, so we're used to going to work every day, and now all of a sudden we are not going to work every day. Our kids are used to going to school. They're not going to school. They're homeschooling. So our whole daily routine is changed because of COVID. So that problem of sheltering at home changes the circadian rhythms. It makes you go to bed later. It may make you sleep later, so that you're spending more time in bed. You may have trouble spending more time in bed because you feel like you can't sleep, you can't fall asleep, you can't stay asleep. Sometimes that's because of what we do at home. We may drink more caffeine, we may be more anxious, we may drink more alcohol to try and calm us down. And as we're all doing right now, we're on the computer, we're in front of the TV, we're binging on movies and TV shows that we didn't spend as much time doing before. So that all that screen time is terrible for your sleep. So you want to try and limit it as much as you can, but sometimes that's just not possible. So all of that leads to sleep disruption. You get bored in the middle of the day and you decide to take a nap. Napping too long in the middle of the day is definitely going to make it harder for you to sleep at night. Drug use, whether it's marijuana, whether it's opiates, whether it's alcohol, all of that can change your sleep patterns and make it harder for you to get a good restful night's sleep. So paying attention to, I'm going to call it sleep hygiene, trying to go to bed at the same time every night, trying to keep your room dark, trying to limit the screen time, definitely within an hour of when you want to go to bed, but trying to stick with a routine despite the fact that your whole life has been turned upside down and your routine is not what it was, is going to be very helpful, because sleep is good for your thinking, sleep is good for your mood, sleep is good for your energy. So paying attention to good sleep hygiene is huge in terms of combating the side effects of COVID-19. Okay, good. So any questions, anything I didn't touch on that you wanna, that maybe I can answer for you?
Thank you for that information. Certainly if anybody has any questions, you can unmute yourself and ask the question, or if you'd like, you can put it in the chat box and then I can ask it for you. All right, here I'm gonna, let me just see. You could also raise your hand if that's helpful. Although some of you I can't see, so maybe it's not helpful. All right, excellent. All right, well, thank you, Dr. Colcher. I really appreciate that information. I know we do get a lot of questions about COVID, and it has been surprising to see some of the neurological effects that I think, you know, we thought lung disease, not neurological disease, and we're seeing some of the long-term effects are doing just that. So thank you very much.
All right. Thank you, guys.